Welcome to our podcast. Today, we're discussing an intriguing topic about congenital pulmonary airway malformation, CPAM. Let's dive in.
I'm excited to discuss this. What's the main point about CPAM we're covering today?
Well, CPAM is a rare congenital lung disease,
Right.
but it's actually the most common type of congenital lung lesion in newborns.
Interesting. How does it develop?
It's like, during fetal development, the lungs don't form properly.
I
The
see.
development stops at various stages, leading to malformations.
So genetics play a role here?
Yes, several genes are involved, like the sonic hedgehog gene. Funny name, huh?
Haha.
They influence cell growth and death in the lungs.
But CPAM happens randomly?
Exactly. There's no genetic predisposition or link to maternal factors. It occurs
Mhm.
sporadically during development.
How do doctors detect CPAM before birth?
They use prenatal ultrasounds to spot lung anomalies.
That's
If
helpful.
needed, MRI can provide more detailed images.
That must help parents prepare.
Definitely. Early detection allows for planning and monitoring. If the lesion is large, interventions can prevent complications like fetal hydrops.
What's fetal hydrops again?
It's when fluid builds up in the fetus. Really serious.
Oh, wow.
Early intervention is crucial to prevent it.
So after birth, what's the treatment approach?
If the baby is symptomatic, surgery to remove the affected lung tissue is usually performed.
Makes
It
sense.
helps alleviate breathing difficulties.
And if the baby isn't showing symptoms?
Well, that's debated. Some doctors suggest surgery anyway to prevent future risks like infections or, malignancies.
Right.
Others opt for careful monitoring.
It's a tough decision for families.
It really is. The healthcare team works closely with the family to decide the best course.
Are there different types of CPAM?
Yes, there are 5 types, each originating from different parts of the developing lung. Type 1 is the
Interesting.
most common.
How do they differ?
They vary in cyst size and location. For example, type 1 has large cysts and a good prognosis after surgery. Type
Okay.
3 is solid and can compress other lung tissue.
Does the type influence treatment?
Absolutely. Knowing the type helps in planning management and discussing outcomes.
Sounds like a multidisciplinary team is essential.
Exactly. From obstetricians to surgeons to nurses, everyone plays a role.
Right.
Communication is key to success.
It's amazing what teamwork can achieve.
It truly is. With early detection and coordinated care, many children with CPAM have excellent outcomes.
That's great news. Thanks for explaining all this.
My pleasure. It's fascinating how medical advances help us manage conditions like CPAM.